Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us for another segment of Health Professional Radio. For millions of Americans living with moderate to severe plaque psoriasis, warm weather can mean relief from painful symptoms. In fact, sunlight exposure can contribute to an improvement in psoriasis symptoms. However, despite the potential benefits, some patients still feel embarrassed by their skin. Now, many will choose to cover up with more clothing or even avoid social situations altogether. But everyone deserves to have fun in the sun. So, joining us now is healthcare provider Melinda Greenfield with how moderate to severe plaque psoriasis patients can make the most of warm weather. Welcome to Health Professional Radio. Dr. Greenfield, thank you so much for joining us.
Thank you. I'm happy to be here today.
Great. Well, what can you tell us about psoriasis and how common it is? I said that millions were suffering from it.
Yeah, so psoriasis is a chronic hereditary condition. What that means is it's not contagious. You're basically born with the condition, but we don't usually see it until kind of midlife around the 50s. What happens with this is the immune system is triggered, and with that trigger, the skin cells build up faster than they should. And the result of that are these red, thickened, scaly plaques that we commonly see on the elbows and the knees, but of course they can show up anywhere, including on the scalp. Sometimes these itch. Sometimes they can get so thick that they actually crack and bleed, and they can become very uncomfortable. As far as how common it is, at any given time, we have about 8 million Americans walking around with psoriasis, and 20% of those can be categorized as moderate to severe plaque psoriasis, which means that they have approximately 10% of their body surface area covered with these unsightly and uncomfortable scaly plaques.
Is moderate to severe plaque psoriasis a seasonal thing?
Well, as you mentioned, the sunlight can actually help psoriasis. So in certain climates, it might get worse in the winter. But the reason why we're talking about it now, why I see a lot of patients in the summer, is exactly what you said. Patients want to get out. They want to go to that pool party. You want to put on that nice new sundress. But they are embarrassed. They have these unsightly plaques, and they know that people see them. They feel judged. And so they're more likely to want to cover up, and, you know, they're missing out on a lot of fun times in life when they should be out there enjoying things and actually getting a little bit of sun, which can help their psoriasis.
So there is quite a bit of stigma surrounding the condition.
Absolutely. Yeah, patients come to me very upset, and they are wanting relief because it affects every aspect of their life, whether it's relationships, job, even wanting to go to the gym. They feel embarrassed that patients are going to look at them and think that they're dirty because they see this cracked, dry, flaky skin.
So what are some of the available treatment options?
So since this is kind of a lifelong condition, a lot of patients will march through a whole variety of treatments. My goal is getting a treatment for my patient that makes them feel happier and healthier in their skin. Generally, they'll start out with various topical therapies. We have creams. We also have systemic therapies like pills. One group of therapies that I do want to talk about today are biologics, and that's why I've partnered with Sun Pharma to talk about this category to discuss treatment options for moderate to severe plaque psoriasis. And one biologic in particular that I've had success with is called Ilumya. A biologic therapy is an injectable treatment. And as with any treatment, there are going to be risks and benefits. And it's important to understand what's involved with this. And patients should talk to their doctor and, of course, figure out what's going to be the best for them. What I like about Ilumya is that patients can see clearer skin in as early as 12 weeks. Mm-hmm. So, you know, we still have some summertime left, and if patients are wanting to get clear, this is a really good option for them, and I have had a lot of success with it. And what is involved is that patients will come in, and they get 2 loading doses, and then it's just 4 injections through the year.
4 throughout the year, that's all?
Yeah, and these patients are pretty clear, and they can go on and enjoy their summer. And even after years of being on the treatment, the medication is keeping these patients clear and they've been very happy with their success.
At just 4 treatments a year, what was the go-to before Illumia? I mean, what was it an everyday thing? Was it every month? 4 times a year seems to be extremely convenient.
It is. I have seen such an evolution in the management of psoriasis. I've been a dermatologist for almost 25 years. So looking back to my early career, we had patients coming in 3 times a week, going into the light box. They'd be putting creams on their skins 2 to 3 times a day. And even with the best treatments that we had back then, they were, maybe just seeing some improvement. And that was assuming that they were putting these medications on daily. The improvement that we see now with this new category of drugs, biologics, especially for moderate to severe plaque psoriasis, I'm telling you, it has revolutionized the treatment of psoriasis. It's actually become one of my favorite conditions to treat because these patients are so happy, and I'm really able to change their lives and get them out there doing the things that they love without having to think about it on a daily basis.
Now, in addition to treatment, what are some of the things that your patients have found helpful in managing their symptoms, in addition to Illumia or any other treatment that they find helpful?
Well, since our skin is the largest organ in our body, of course, everything we do is going to affect the skin. I love talking to my patients about diet and lifestyle, a healthy diet, getting a good amount of exercise, making sure you're getting good sleep, avoiding stressors, of course, not smoking, alcohol. All of those things are going to be important in the entire package, along with, whatever treatment you decide or after talking to your doctor that you find that's going to be best for you.
If patients are struggling with their moderate to severe plaque psoriasis, what should they do? What's the takeaway that you want patients to latch onto?
Absolutely. So, a lot of things can present as red scaly plaque. So, of course, the first thing you want to do is talk to your doctor or find a dermatologist that you can go to and, make a definitive diagnosis of what you have. Talk to your doctor about the treatments that are out there. Make sure you understand the risk and benefits. And if you want to get information right away on the treatment that I'm talking about today, you can go to Illumia.com. That's ILUMYA.com. Go ahead and read about that today, and you can get information on this treatment for moderate to severe plaque psoriasis.
Dr. Greenfield, it's been a pleasure speaking with you. Thank you so much for joining us here on Health Professional Radio.
Thank you. I've been happy to be here today.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Melinda Greenfield. Audio copies of this program are available at healthprofessionalradio.com.au, also at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.